Hey everyone, it's Dr. Weens here. So the big rage is AI. Is it good? Is it bad? Clearly, AI posts that I've done have had the most impressions, some up to 3,000. So I thought I'd give you a little information on, well, what specific things would I look for as a doctor when I'm using AI. Now, I use a platform that's called Open Evidence. You have to have your NPI number to use that. But if you're a mid level practitioner or if you're a physician, it can be extremely helpful. For instance, let's start with one example. I had a patient come in who was applying for the armed forces, and he needed a prior authorization letter or a letter of clearance that allowed him to join the armed forces even though he had allergies but they weren't active, wasn't taking any medications for them, and he had also been diagnosed during childhood with asthma, but he now participates in sports and doesn't have any problems with his breathing. Well, voila, hit the button, and here we have a prior authorization letter for him, and it worked out really well. A second case would be, well, what if you are confronted with a host of symptoms, but you don't know quite where to put them and don't know quite what diagnosis you want to look for? Well, that happened just this past week. Patient came in with some dizziness and almost passed out, had some nausea and vomiting, had a lot of abdominal pain. And initially I thought, well, with the abdominal pain, it's got to be obviously something in the stomach, something with the intestines, maybe one of the solid organs, liver or spleen. So I ran a differential diagnosis query for Open Evidence, and they're used to that. They actually do quite a good job. And it gave me a list of probably 5 to 6 things that I should consider. Some I was already considering, but there were some new ones. And then there's a special section when you query for a differential diagnosis that says make sure you don't miss blank. And in this case, it was to make sure that I didn't miss the acute coronary syndrome, which can produce, has some syncope and also some abdominal pain, which is a completely different organ system. I was looking only at the abdomen based on the symptoms that the patient had, but I should have also looked at their coronary status and work that up if it was necessary. So this is kind of fun to actually see how important AI and how helpful AI can be. Stay tuned.